Melanoma is a type of skin cancer that originates from melanocytes, the cells responsible for producing the pigment melanin. It is considered the most dangerous form of skin cancer due to its potential to spread to other parts of the body if not detected and treated early. Here's some key information about melanoma. Causes. The primary cause of melanoma is excessive exposure to ultraviolet (UV) radiation, typically from sunlight or tanning beds. However, genetics can also play a role, as individuals with a family history of melanoma are at a higher risk. Risk factors. Risk factors for developing melanoma include fair skin, a history of severe sunburns, numerous moles, a weakened immune system, and a family history of the disease. Signs and symptoms. Melanoma often starts as an unusual mole or growth on the skin. It may exhibit the ABCDE rule for identifying potential melanomas. A. Asymmetry, one half doesn't match the other. B. Border irregularity, ragged, notched, or blurred edges. C. Color variation, uneven coloring or multiple colors. D. Diameter larger than a pencil eraser, about 6 millimeters. E. Evolving over time, changing in size, shape, color, or elevation. Diagnosis. A dermatologist may use a combination of visual examination, dermoscopy, microscopic examination of skin lesions, and biopsy to diagnose melanoma. Staging. Melanoma is staged based on the thickness of the tumor, how deeply it has penetrated the skin layers, and whether it has spread to lymph nodes or other parts of the body. Staging helps determine the prognosis and appropriate treatment. Treatment options depend on the stage and extent of the melanoma. Common treatments include surgery to remove the tumor, targeted therapy, immunotherapy, radiation therapy, and chemotherapy. Early-stage melanomas are highly curable through surgical removal. Preventive measures include using sunscreen with a high SPF, wearing protective clothing, avoiding direct sun exposure during peak hours, and avoiding tanning beds. Regular self-examinations and annual professional skin checks can help with early detection. Prognosis. The prognosis for melanoma depends on the stage at which it is diagnosed. Early-stage melanomas have a high cure rate, while more advanced cases have a higher risk of spreading to other parts of the body and can be more difficult to treat. It's important to remember that any suspicious changes in your skin, moles, or growths should be evaluated by a dermatologist or a healthcare professional. Early detection and prompt treatment greatly improve the chances of successful outcomes.